Evolution Clinic, sir.
Hmm.
The Preoperative Evolution Clinic was developed with the goal of focusing all preoperative clinical services into hospital location to establish a center of visibility, competitiveness, and efficiency. Preoperative Evolution Clinic is a visible collaboration between departments of surgery, anesthesia, nursing, and hospital administration. The operative goals. It is to provide a centralized site for preoperative evaluation, avoid logistic shuffling of patients to multiple hospital sites, to provide anesthesia consultation for evaluation of medically complex patients, establish rapport with patients and reduce anxiety, improve patient care by providing personalized care, comfort, and convenience, improved education of patients and families about their surgical procedure, and proposed anesthesia care, including postoperative pain control options. To educate patients about what to expect regarding postoperative feeding and discharge needs, to ensure cost-effective ordering of preoperative laboratory and diagnostic studies, to reduce number of cancellation and delays in operative procedure on the day of surgery, to ensure availability of medical records at the time of preoperative evaluation, to ensure patients and surgeon satisfaction. The requisite facilities, registration and reception area, adequate number of examination rooms, patient and family education room, phlebotomy and ECG room, area for admitting, financial and insurance services, computer support room, and restrooms. Preoperative evaluation clinic aims at evaluating patient for potential risk during surgery and postoperative period. Patients should be screened and triaged to determine patient's current health status. Standardization of preoperative process done in pre-anesthetic clinic. This is useful as it allows for development and implementation of clinical algorithms to optimize preoperative medical management and reduce complication. This can reduce cost of admission and length of stay. It allows more accurate data collection. It minimizes complication caused by communication errors. The clinic activities. Surgeon office schedules a pre-anesthetic checkup appointment. Flexibility in scheduling appointment is required to accommodate patient with urgent surgical requirements. Anesthetist interviews and examines the patient, obtains relevant medical information, and determines appropriate diagnostic, laboratory, ECG, and other evaluation requirements. Phlebotomy and ECG and hospital admitting and insurance registration are all available at the clinic. Patient ECG is assessed during the visit and lab results evaluated at the end of each clinic day. Thus, significant abnormalities can be addressed immediately and cases cancelled the day before surgery. A nurse educator trained in perioperative teaching discusses the surgery and hospital processes with each patient and family member to increase patient awareness and comfort, thus reducing the fear and anxiety. The role of anesthetist. The anesthetist is the only specialist who can decide on whether the patient is appropriate for anesthesia and stable to proceed. The anesthetist should develop leadership and management position in the pre-anesthetic evaluation program. That's all, sir.
Okay. You are working in Miot, correct?
Yes, sir.
Do you have a pre-anesthetic clinic?
No, sir, we don't have
You
a
don't. You
pre-anesthetic.
go to the patient's room or the ward
Yes,
and
sir.
you
Yes,
are
sir.
asked to go and see the patient, isn't it?
Yes,
So
sir.
what is the main purpose of a pre-anesthetic clinic?
Sir, the main purpose, like we mentioned, we can avoid shuffling of patient to multiple sites, and we
Okay.
can evaluate and ask for diagnostic lab procedures and all.
Hmm.
And in the same setting, we can collect blood and ECG, sir. And we can also give advice to optimize the patient and whether or not the patient is
Now
fit
you
for
are
surgery.
repeating what you have written in your answer, which has been taken
Yes,
from an article in IJ, right? Indian Journal of Anesthesia. Gupta, I think he wrote about this. This is a very good article that you have taken the answer from. But
yes, sir.
when you go to assess a patient in the room or ward, do you find all the investigations already ready when you go there?
No, sir.
No. For an elective
Most
case, for
for
example,
an
if you
elective case, yes,
ah,
mostly it will be radio only, sir.
yeah, so
But
when
few
before the
investigation
surgeon
will be asking for. Yes, sir.
yeah, before the surgeon refers the patient to you, already most of the workup has been done, isn't it?
Mm-mm. Yes, sir.
Because they have the routine protocol of getting the surgical pack, anesthetic pack, all that, and they will routinely do all the tests and keep all the tests ready, and then only they send the reference or the memo to you for come and see the patient and give fitness. And if you feel that patient requires any other extra investigations like a treadmill or a angio for a coronary artery disease patient, then you make your suggestions and then the surgical team will order for that and get it done, isn't it?
Yes, sir.
That is how the whole thing has been going. But in Western countries, where there are specialized pre-anesthetic checkup clinics, the patients are asked to come to that clinic and assemble there, and so that they can be evaluated, and most of the tests are ordered by the anesthetist only. Of course, there will be a routine protocol to do the basic minimum investigations for all the patients coming for surgery, and any extra tests will be ordered only by the anesthesiologist and not the surgical team. So that is the practice that goes on in the Western world, and that is how the books also write here. So it, from practical point of view, it is slightly different from what is given in the theory or the textbooks. In practice, we don't specifically order any test for the patient. We suggest it to the surgical team and they do it and then send the patient back with the results. Whereas in the Western countries, the pre-anesthetic check, all the tests are prescribed only by the anesthesiologist, and then the results are interpreted and the anesthetist gives the fitness and then uh, evaluates the patient. There is one problem with this. Supposing you are in the duty of a pre-anesthetic clinic and you evaluate the patient. One whole month you are going to do the evaluation only in the pre-anesthetic clinic and you give your fitness. But when the patient goes to the theater, is the same anesthetist going to anesthetize the patient?
No, might be
No.
different
They
anesthetic.
depend on what you have evaluated and you have done. So anyway, the theater anesthetist has to make a quick re-examination of the patient, make sure that all your findings are correct and patient is fit for surgery. For example, in the pre-anesthetic check, you make a malambity decision of 2 or 3, and in the OT he finds it is more than 3, because the evaluation can differ from patient to patient. So, I mean, anesthetist to anesthetist. So everybody has to make a cursory examination and confirm, even if there is a pre-anesthetic clinic, the person who is going to anesthetize the patient, after going through the records, he should also make sure that the patient has been evaluated properly. That is number one. Small drawback with the pre-anesthetic clinic, because the person assessing the patient may not anesthetize the patient. That is one problem. The second problem, or the thing that is advantages in the pre-anesthetic clinic, is nowadays many surgeries are done as daycare procedures, isn't it?
Yes,
Short
sir.
surgeries, many of them are all done as a daycare procedure to avoid unnecessary hospital stay and expenditure for the patient. So in such cases, patients are evaluated as an outpatient without getting admitted into the hospital. So it will be more beneficial. These clinics will be beneficial to the patient to get all the consultation done as a pre-outpatient, get their fitness done, and then come and get admitted on the day of surgery, get the surgery done, and go back home the same evening. That is the advantage of this pre-anesthetic clinic. And the third point you have to add to this answer is, nowadays, even if the patient is not able to come in person, there are other modalities of like video calls or the internet and WhatsApp connections. They can send all the reports, then come to a Zoom call or a video call, and then interact with the anesthesiologist and get the fitness done and come for the surgery, unless they belong to ASA category 3 or 4, where there are more complications, where you would like to see the patient in person. ASA category 1 and 2 patients can have a tele consultation and come for surgery. Okay, so these are all the points that you can add to your answer.
Yes, sir. Yes,
And,
sir.
I'll just share these points from my point of view.